Hi, everybody. I'm Dr. Adam Rindy, and I'm the host of the One Thing podcast. Welcome to episode number 101. In this episode, I have the great pleasure of welcoming on Dr. Nancy O'Hara, and we are discussing PANDAS and PANS. Dr. O'Hara is an expert in this topic and author of Demystifying PANS and PANDAS, a functional medicine desktop reference on basal ganglia encephalitis. You can follow her work at drohara.com. PANDAS is an acronym for Pediatric Acute-onset Neuropsychiatric Disorder associated with Streptococcus infection. PANS is an acronym for Pediatric Acute-onset Neuropsychiatric Syndrome. The key feature in these conditions are the sudden onset of neuropsychiatric symptoms. These may include OCD, ADHD, anxiety, aggression, tics, dysgraphia, and this literally happens overnight. These episodes may follow a Streptococcus infection, viral infection, mycotoxin exposure, vector-borne-illness, and other exposures. In this episode, Dr. O'Hara helps us understand PANS and PANDAS from a patient and family perspective, the trials and tribulations of getting a diagnosis. We discuss her three-pronged approach to treatment. We discuss how complicated it is to receive a diagnosis, the challenge of finding lab work to back up a PANS and PANDAS diagnosis. We also discuss the impact of SARS-CoV-2 on PANS and PANDAS. Dr. O'Hara has a mentorship program and a membership program, and we discussed that in this episode as well. Detailed show notes can be found at onethingpod.com/PANS and PANDAS O'Hara. I'm going to tell you a little bit more about Dr. O'Hara, and you can read her complete bio in the show notes. I first met Dr. O'Hara in 2006 at a Defeat Autism Now conference, where she lectured extensively on autism spectrum disorder when there were very few people speaking about it in a functional medicine perspective. I still reference those notes to these days. Dr. O'Hara graduated from the University of Pennsylvania School of Medicine. She also earned a master's in public health from the University of Pittsburgh. She started a general practice and eventually went into a specialty practice in 1998, focusing on helping children with neurodevelopmental disorders. She treats patients with chronic illness and conditions such as ADHD, PANS, PANDAS, OCD, Lyme disease, and autism spectrum disorders. I think you'll really enjoy this conversation. Please share this episode with loved ones and people you think may benefit from hearing this information so that they may shed some light on this community of people dealing with PANS and PANDAS, and also share it with people who may be concerned that they might have PANS and PANDAS and are not getting the proper diagnosis. So without further ado, I welcome you to the next episode of the One Thing podcast.
This is the One Thing podcast, and I'm your host, Dr. Adam Rindy. The One Thing podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine.
Dr. O'Hara, welcome to the One Thing podcast. It's a delight to be here with you today.
It's really delightful to be here with you, Adam, and thank you for inviting me.
You're welcome. We were catching up on my first introduction to you in 2006 at a Defeat Autism Now conference in Seattle, Washington, and you were one of the featured speakers with Dr. Sydney Baker. And that was a big moment in my career, a big influence on the way I wanted to eventually practice medicine. And I would love to talk with you about what what's changed in your practice and your life since the late 1990s and early 2000s. We were talking a little bit about that, and I'd love to kind of go into that more.
Yeah, I started my career as an allopathic physician. I was a partner in a general practice, and then I went through 5 years of infertility in the 1990s, and nothing in Western medicine was helping me. And I met Dr. Baker as a patient. A patient of mine had gotten better with diet, which at the time, as an allopathic physician, I thought was hooey. But because of the infertility and nothing was helping me, I said, go as a patient, see what happens. And I was pregnant 6 months later, and started my own practice a couple of years later, and the rest is history, And I started my practice in the late 1990s for children with autism and other neurodiverse, neurodevelopmental issues. And then and that's what I was doing when we met in 2006. And then in 2009, my then 9-year-old son developed seizure-like tics after getting strep throat, getting bit by a Lyme-positive tick, and getting a viral infection all in the same week. And that's when I learned about PANS and PANDAS. And that changed the trajectory of my career to now in 2022, I published a book and have several other projects along those lines. For me, though, the similarities are as important as the difference, because it's always about the history and the physical exam. Whether it's autism or PANS and PANDAS, the top 10 biomarkers are history and physical exam. And I remember it wasn't probably much longer after 2006, a bunch of us got together and we were told to write down the top 10 biomarkers. What tests should we be getting in all our kids with autism to, get in on this? And I just wrote over and over again, history and physical exam, because we can learn so much from that. And that comes from Sid, and for your listeners who do not know Dr. Baker, he is the grandfather of functional medicine. And he taught both of us so much, and all of his Sidisms, if you listen, they will come. That's the history, have we done enough for this child? That's repeating that over and over again. That's not getting the next test. If you sit on 2 tacks, removing 1 tack doesn't make you 50% better. You've got to look at the whole child. And that's what I do in PANS, PANDAS, and that's what I did and still do in autism. What's changed the most is COVID. And I think whether, you're talking about the disease or the injection, it reactivated a lot of other infections, particularly dormant viral infections and dormant vector-borne diseases, Borrelia, Babesia, Bartonella, as well as others. And so our kids now are sicker. They're a little bit more resistant to treatment. And I don't think it's just because I've been doing this for 30 years. I hear it from a lot of clinicians. And I also don't think it's just because of lockdown and masking and sheltering in place and all of that, although that didn't help any of us. It certainly is that our children, we're seeing, certainly in the area of the country where I live, Connecticut, much more tick-borne diseases as part of the abrupt onset of neuropsychiatric symptoms as we see in PANS. And I think maybe, I'm always looking for silver linings, maybe a few more people are coming to the table. Maybe a few more people are seeing that infections and other triggers can be the beginning of a neuropsychiatric illness. And so if that's the case, yay, I'll take it.
Right.
So those are the things. But, as a functional medicine physician now for the last 30 years with 2 naturopaths in my practice, a dietitian, lots of therapists, it takes a village.
Yeah.
And unfortunately, and I apologize to any allopathic physicians that may be listening, but unfortunately, most of us don't spend enough time doing history and physical exam, don't look outside the box, and don't think of things outside of pharmaceuticals. And we need to, because there is so much health and wellness that can come from herbals, botanicals, nutraceuticals, and just healthy lifestyle and diet.
Sure. Yeah. I want to circle back on the COVID comment and just go a little bit further into this clinical medicine and clinical diagnostic discussion. It's interesting with one of the things I remember from that conference was Dr. Baker had talked about approach to the patient, approach to working with a child in your clinic. And one of the things, that really stood out to me is that he said to allow, especially in neurodivergent children, to allow them to approach you and get on their level in the way that you communicate and allow them to initiate the eye contact was profound. I can't imagine AI being able to do that.
No.
Or any kind of test to be able to establish a relationship.
Absolutely. And I'd say, one of the things that I have kept all these 30 years is you have to come to the office once a year to be a patient of mine.
Mm-hmm.
And I now only take new patients from Connecticut, New York, or New Jersey. But even so, I think getting your hands on, meeting people, making that connection, if you have to do it through telehealth and remotely, okay, but you need to meet them where they are. And Sid always talked about our N of 1. That's our clinical trial. What is going on with this child? And unless you meet that child and family where they are and really connect with both the child and, in my opinion, both parents, or maybe there are 10 people, takes a village, whatever it is that's taking care of this kid, that's what's really needed to help a child. And one of the things that's changed a lot for me, and I do want to tell this brief story, is spellers, which is spell to communicate. And one of the things Sid taught me very early on is every child is in there, no matter how anxious, how neurodivergent, how non-speaking, stimming out the yin yang, they are in there, and treat them as if they are. And I had one young man who had destroyed his home, destroyed the family. Nothing had ever worked. He was non-speaking. And the mom called me right before COVID and said, I want you to see Alex. There's something that's changed. And she had found spellers, which is learning how to communicate through spelling. And this young man, who had never said a word in his life, knew 7 languages. When he was stimming through all the books, he had a photographic memory and was learning every word. He had a wicked sense of humor. And now, with many of my patients who are non-speaking, through this program, I can fully communicate with them through typing.
Wow.
And they are there. Our whole, you went to what was then a Defeat Autism Now conference. The conference now is the Medical Academy of Pediatric Special Needs. And anybody who went years ago, it's changed. It's new in the last 2 years. And just last March, we had a whole conference dedicated to the neurobiology of communication. And Sid was the first person who really taught me that. I had taught children with autism before I went to medical school. And I always say medical school was a heck of a lot easier than teaching. And I fully believe that. But, seeing these children as fully present and being present with them is a huge part of the clinical history, physical exam, and care of these families.
Yeah. And along with that, working with the parents and all that they're going through during these moments and helping them be able to trust you and trust the practitioner and trust the process.
Yeah.
Most of them, especially with PANS and PANDAS, have been told by so many people and so many providers that this isn't possible. I've never seen something like this. Or, they're the one person where everybody dismisses time after time. And it's such a frustrating and debilitating thing to go
Yeah.
through.
Yeah, and a few things on that point. I totally agree with you. And number one, the most important instrument in my office is a tissue box. Because, parents have been to 13 different practitioners and not found answers or even permission to talk about such an illness. And their lives have changed often overnight, or have been difficult for so long, they don't know where to turn. And the second piece of it, I have been there, having my own son go through it. And, he didn't even believe he had this disease till a couple of years ago, and he's now 25. But anyway, that's another story. But, I could say, I know the PTSD of this disease. Even when your kid gets better, I always tell the story. My son was 19. He had been totally fine for years. We were in a hotel and he said, "Mom, I'm feeling blue. I feel horrible. I'm not, all these negative things. And I'm going through, is it strep? Is it mold? Is it Lyme? Is it Bartonella? Is it, I'm not sleeping for 4 nights." At the end of 4 days, he finally says to me, "Mom, it's about a girl." And it reminded me that my PTSD, my worries were as important. And it's that whole put your oxygen mask on first. And that goes to also meeting the families where they are. Every family can't do or shouldn't do IVIG. Every family is not going to be able to or want to do, for example, Helminth therapy, which is a big thing Sid and I both talk about. They may not want to do antibiotics. They may want to do herbals or vice versa. It's important I always talk about us as their GPS. I may be a pushy GPS, but I'm giving you the route as a patient, as a parent, to go down that I think is best for your child, but you're still driving the car. And I think that's important, especially I think as an MD, we have a tendency to say my way or the highway. I know best, so you do this. That is so wrong. And I think naturopaths are certainly much better at it, but even so, in any practice, we need to meet the families where they are and work with them. We need to co-captain their ship and help them, because that empowerment is so important for the child as well as for the family in getting to health.
Yeah, great point. Yeah, and I think you and I were introduced a second time by Dr. Krista, and all three of us have been through medical ordeals with our children, and I can completely relate to that. Once you've been down that road, you no longer look at things lightly, and you have to really relearn how to, back up and say, "Oh, it is about a girl," or "It is about a." Common things happen commonly, but that world changes once you've had a sick child. And
taking care of you, and realizing that in yourself too. But also the other point that I think is important is to, with PANS and PANDAS, oftentimes we see that child as a sick child. They are sick. They are medically ill. There is inflammation in their brain. But that doesn't mean they can't still do their chores. They can't still wake up in the morning and make their bed. There has to be that anticipation and that expectation of you're still part of this family, because I call it feeding the beast of the disease. If we feed the beast of the disease too much and we give in, then those secondary gains of not having to do the chores or homework or whatever start to take over. And that's a really, and together with that is also a phrase a therapist once taught me, which is to say to your child, "I get it." Even when you don't. The first words need to be, I get it. Not I get it, but I get it. And that way they can feel more comfortable talking to you. Now later in the car on a walk, you may say, "Hey, you know what? We talked about this thing and you were saying this. I think about it this way." Maybe, but let them know they are heard. And that goes back to what I was saying about the families too. That's what I try to do, is hear them and what their stress is, what their problem is. And when I'm treating the symptoms, that's part of my three-pronged approach in treating the symptom that's affecting them the most.
Yeah.
I may think the sleep is the biggest problem, but they think it's the way the kid is hitting the mom or the tic the kid has or whatever it is. Treat that symptom first.
Yeah. So I think that's one thing that's really stood out in your approach. In this world of functional medicine, there's sort of this well-intended philosophy of treat the root cause, and we're going to reverse this disease or reverse this process by treating the root cause. And it took me a while to learn this, but realizing that that's great. However, you need to be able to get to a point where that's the right timing.
Right.
So I love your 3-step approach. And I think maybe if you could clarify what that is and how that came to be.
Yeah, absolutely. So let me just start with PANDAS, which is pediatric autoimmune neuropsychiatric disease associated with strep. So the kids that get it, 1 in 200, although it's about 1 in 2 in my practice, rather than the antibodies or the proteins of the immune system attacking the strep in the throat, they instead attack the brain and cause inflammation in an area of the brain called the basal ganglia. And that's what leads to OCD, anxiety, tics, urinary symptoms, sleep disorders, on and on and on. So you need to treat the underlying infection. So if it was strep or mycoplasma or COVID, that's one part. And a lot of people will do that. What is often missed is you have to treat the immune system. And that doesn't mean just ibuprofen, steroids, and IVIG. You and I both know there are tremendous amount of nutraceuticals, herbals, botanicals that treat inflammation very well. But then the third piece is treating the symptoms. And so again, MDs will do that well in just putting them on an SSRI to treat their severe anxiety or whatever, but that doesn't get to the root cause. But we could add 5-HTP or lithium orotate or N-acetylcysteine or, hemp oil or whatever it is to treat that symptom while we're getting at the underlying root cause trigger, and we're treating the inflammation that has happened as part of that underlying root cause. So if we just treat the root cause, that can take 9 months, 2 years, and we're letting the kids sit in their anxiety or OCD or getting Herx reactions, die-off reactions as it gets worse. No, we have to do all three. So whenever, like I just saw 2 new patients, 2 siblings today, and I remind myself, all right, am I treating the underlying trigger? Yeah, they were triggered by COVID. I've got some antivirals in their herbs, antioxidants, etc. All right, am I treating the immune system? Yep, I got turmeric or curcumin or, hemp oil or SPM, specialized pro-resolving mediators. Okay. And am I treating the symptom? One of the kids, it was tics. So I was adding more magnesium. The other kid, it was aggression and anxiety. And so I was using some GABA and theanine and, so I had a little bit for each one, doing some tests, not much. Most of it was through a conventional lab. And then moving forward from there, and we'll see what works.
Yeah, it's brilliant. People need to have some stability, right, to do this type of work, and feeling better improves psychological health and motivation and all these other things. So I think that's just such a brilliant approach, and I'm glad I've learned that as well with my patients, and really I'm looking to help them feel stable and more comfortable first before getting into these nitty-gritty areas of work.
Yeah.
So you were saying earlier along these lines that the patient will lead with a symptom, and you may feel like there might be another symptom screaming out or what have you, but you'll follow the patient leading with a symptom. Can you talk more about that?
Yeah. So we have 30 pages of questionnaires. I learned from Sid, and as you've told me, Adam, his list is so long, and getting people to fill it out. Now, I don't have trouble, and he probably didn't either, because they've seen that 3 or 13 doctors before they come to me. So they'll fill out every form I have. But I get a sense from that what symptoms the child has. So I know, this sleep is really disrupting everything else. So I know I've got to treat that, because nobody's sleeping. So nothing is going to function as well. But they're just so upset that the kid is, acting out in school or something else. So I'll talk to them about both what I see as the biggest symptom that need to be treated and what they see as the biggest symptom that needs to be treated. And sometimes I treat them the same way. The kid that has sleep disturbances and tics, magnesium may work great. The kid that's got anxiety and sleep problems, I may be doing the hemp oil at bedtime. I may be doing the 5-HTP, during the day and at bedtime. So it may be the same nutraceutical or herbal that I'm using, but I'll talk to them about, I want to treat the symptom that's bothering you the most. But I also want you to hear that unless you guys are sleeping, unless you guys are eating a little bit better or whatever it may be, this isn't going to get better.
Okay. So with the inflammation component, we're talking about neuroinflammation primarily. And so much of what we know about neuroinflammation comes from cytokines and different receptors in the brain. Are we at a point where we know what the PANDAS brain, like the inflammation that's associated with the PANS and PANDAS phenotype of, symptoms?
Yeah, great question. We know that there's a breakdown of the blood-brain barrier, and that's very important. And we know there are Th17 strep-specific molecules that are part of the issue. We also know we live in a toxic world. So the blood-brain barrier is getting broken down, just like the leaky gut and everything else. But in PANS and PANDAS, it is microglial inflammation within the basal ganglia, the caudate, the putamen, that area of the brain. I always hesitate when people are doing big, expensive tests, autoimmune panels and, brain antibody panels and, cytokine panels and all that to prove whether the inflammation is there or not. Every single test can be perfectly normal, every single one of them, and it still be PANS or PANDAS. If it was an abrupt onset of neuropsychiatric symptoms after 3 weeks to 3 months after an infection, or as Jill talks about all the time, mold exposure. And, the mold and the vector-borne disease, the Borrelia, Bartonella, Babesia, and more, can be much more subacute. Also, the onset of symptoms can be more subacute when it's the second or third or fourth time that this has happened. And it can be more subacute in adults, and it can happen in adults. So by the definition, it's pediatric and abrupt onset, but there are a lot of caveats to that. But because the inflammation is in the microglia, in the microscopic, you will see it on biopsy, but nobody's going to do that. But short of that, you may not see it on a SPECT scan or on MRI or on any blood tests. We know it is mast cell activation, particularly with vector-borne, and as Jill talks about a lot, mold-induced, definitely mast cell cytokine activation. No question about it. But those tests, because they're grossly inaccurate, and more positive in a flare, and when you do it, they may not be in a flare, the test results may be negative.
Yeah. And that goes back to the original comments about like making a clinical diagnosis. And I think that is challenging for people in these times, right? We all want that solid evidence that, if we're going to treat something, that, we have a firm diagnosis. How do you handle those moments where people are not necessarily they're feeling uneasy about, the scenario, and starting treatments?
It's a great question. And I think me today is very different than me 25 years ago.
Mm-hmm.
Because now, after writing the book and, having people wait for months and months and months, they're much more ready, willing, and able to take what I say than somebody that may just be starting out in practice. So right. I want to say that first of all. But second of all, I remind them that this is a clinical diagnosis. And just like if they get the common cold, there's not going to be any tests that show you that it was the cold necessarily. Every rhinovirus you get may not show up in a culture.
Right.
And I say, but you have a cold because, you're blowing your nose and you feel lousy and, and so you don't need a test to prove that.
Right.
And so I use a lot of analogies in what I do. So I may well use that analogy. I also use Sid's analogy of our N of 1. I say, you may not believe me today, but I hope with these very safe treatments that we're starting today, you'll see improvement. And then our clinical diagnosis will be in your child. So
right.
that clinical trial will be in our N of 1, as Sid said. And I also say we'll do some regular tests, conventional lab tests.
Mm-hmm.
And usually, I'd say at least 95% of the time, there's at least one thing abnormal. The most commonly abnormal test in PANS and PANDAS is an ANA. It's positive in a low level, 1 to 80, 1 to 160, 1 to 320, with a negative reflex panel. So that means there's no evidence of any other collagen vascular disease, lupus, MS, that sort of thing. But in 60% of children in our practice, 56% in the literature, they have a positive ANA. Okay. Those strep titers, though, those mycoplasma titers, even and especially in conventional labs, the Borrelia, Bartonella, and Babesia may all be negative because either 40% of kids with these diseases, minimum, will have immunodeficiency. So they can't mount an antibody response. Mm-hmm. And that's what you're measuring, those antibodies, those proteins. So those may well be negative. Mm-hmm. But I still do them. The other things that may be positive are a C-reactive protein. Those may be elevated. A SED rate may be elevated. Just a platelet count. Platelets, ferritin are an acute phase reactant. So they may be high when there's inflammation. Mm-hmm. Eosinophils within a simple CBC. Some immunoglobulins like IgG4 may be high when it's mold or Lyme related. C3A, C4A, some of those, but those are all conventional lab tests where we don't have to charge the families, hundreds to thousands of dollars to do the test that mm-hmm. may or may not be positive.
Mm-hmm. Interesting. Yeah. So that's really helpful. And I think, a lot of people can relate to in this world of chronic illness that, a lot of times you can take it only as far as you can take it with the data and the evidence and the testing. And you're at that moment where you kind of have to roll out, and the treatment often becomes like testing. At some moment, of course, you try to do your best to get as much workup as possible. So back to this co-infection world, and I want to circle back to the COVID observation. I always go back to this analogy I learned from liver disease, it's more of a toxicant load issue. Mm-hmm. I think they call it tilt, mm-hmm. and where one more introduction of another thing just kind of was enough to kind of push things further in our population. Do you feel like COVID was just one additional thing that we were exposed to that in an already overloaded system was sort of just a nudge that just really went out of control.
The straw that broke the camel's back, sort of.
Yeah, I mean, or do you feel like it's just such a different thing that's why we're seeing these patterns?
Truthfully, I think it's a combination. Because I think it was something where we chose as a society to really lock down, at least in this area of the Northeast. And so that depressed our immune systems. You know, we're not getting out, getting that vitamin D exposure, getting in the dirt, getting exposed to common viruses. So our immune systems were depressed. And then we have this new virus that none of us have ever seen before. And then we have an injection that none of our bodies have ever experienced before. And the combination of all three of those things, and especially when all three were present in one person, it tilted our immune systems as well as our neurologic systems, and still is having long-lasting effects. I do think, though, that the spike protein, the mRNA, have very different impacts on more tick-borne disease than anything else. And I do think that there were dormant infections, dormant other viruses like the herpes virus, monoviruses like EBV and CMV, and then tick-borne diseases that were present in some of our children's bodies, but dormant. And when they got COVID, that brought it out more, that we haven't seen with other viruses, you know, and maybe it was just the globalness of it. We're still trying to figure it out. But we know that we definitely are seeing, I mean, right now in the Northeast, 41% of ticks carry babesia. 42% of the children in our practice that come in with the diagnosis of PANS or PANDAS are positive for Bartonella. And that doesn't even start to mention Borrelia, which is what everybody thinks of as Lyme disease.
Yeah, very interesting. And so in the PANS and PANDAS community, you were saying earlier that most of the patients have some inherited or genetic immunodeficiency. And so these co-infections that are hanging on, is that part of, for that reason, is it because these patients just have difficulty mounting a good response when they're exposed?
And it's not all genetic. I mean, certainly in every disease we talk about, genetics loads the gun, environment pulls the trigger.
Right.
But tick-borne diseases cause immunodeficiency.
Okay.
There is no question about that.
And so does strep, right?
Absolutely. So you can have a low level of immunodeficiency to start with. And I see that just by history. The kids that come in that have had multiple antibiotics, tons of ear infections, sinus infections, they have some level of functional immunodeficiency. That's one set. But then there's the other set that were perfectly healthy. All of a sudden that this happens, the strep or the tick-borne disease, and now they're immunodeficient. Okay. So we know that these diseases do that and cause it.
That makes a lot of sense. And so with the current your current treatment approaches, there's one therapy I wanted to make sure that we snuck in some time to talk about because it's so unique, and it's the Helminth therapy.
Yes.
And I'd love to hear when you first discovered that first, and then what we know about how it's helping the immune system. Yeah.
So I first discovered it when my son got sick. I had patients that were doing a form of Helminth therapy, which just means worms, basically, and worm eggs. They were doing a form that was much more problematic, a lot more side effects. But I was desperate. My son was deathly afraid of needles, probably should have had IVIG, but I couldn't afford it at the time. Would have done it, would have figured out a way, but he was so petrified of needles, I couldn't even think about doing this. I said, let me just try this first while I was doing everything else. And he turned around in 3 months. And Sid was the one who introduced it to me, and it was introduced to him by William Parker, who was a PhD at Duke. And quick story, as a little kid, he used to catch wild rats in Arkansas to make money, behind restaurants and stuff And so when he became a PhD, rather than paying for lab rats, he went out and caught wild rats and used those. And he found that his wild rats were healthier, learned the mazes faster, had less rat OCD and anxiety. And so he started studying it, and he found it was these grain beetle worm eggs. Now, what they're called is HDCs, which stands for Hymenolespis diminuta cysticercoids. I'm not going to say it 10 times fast. I had to practice it for a month before the first time I lectured about it. But anyway, these are grain beetle worm eggs. And when we used to live in hunter-gatherer society, we used to dry our grains in large vats. We didn't process our foods. And we always ate grain beetles and grain beetle worm eggs. So evolutionarily, our bodies are used to it. So now we harvest them in a clean lab. We don't. Dr. Baker's lab does, as well as other labs in the country and in England. There's a company called Biome Restoration. If you want to learn more, you can go to that, biomerestoration.com, learn more about this. But it's a little vial of what looks like cloudy water, tastes like salty water, and you take it once every 2 to 3 weeks. It does not cause any infection. There is no way you can get a parasitic infection from it. Rarely, 1 in more than 1,000 children who are either constipated or are on an immunosuppressive drug could get what's called an infestation, which is where the egg hatches before it's excreted. But in the large majority, you take it, and what it does is it induces immune tolerance. The immune system says, oh, I know you, and reacts against that liquid you just drank, and instead of reacting against self, the autoimmune disease. So it works for alopecia areata. It works for a lot of inflammatory bowel diseases. It works for other immune diseases. I could go on and on and on. I don't usually talk about it at my first new patient visit because they already think I'm a weirdo. I don't want them to think I'm even weirder than I am. But I do talk about it by the second visit as a way of promoting immune tolerance. And it's a lot less expensive and a lot easier than IVIG and works very well.
Fascinating. Yeah, I remember learning about different T cell lines that are influenced by worms and parasites. And I'm just curious, my brain's going down like, which T cell line is it shifting? And I'm excited to learn more about it. So
and there are a lot of places in the country that are doing it. And a lot of other, I know a couple other naturopaths that are just getting started in Helminth therapy and really developing other ways to give it too.
Great. Yeah. So there's a lot of podcasts that you've been on and interviews, and I really like how this went because looking over your shoulder, if people want kind of more of like a outlined approach, and pick up your book. That's an amazing resource. It's so well organized, and it's like a reference book, really, for looking things up. And so you can see it over your shoulder. But for people who are listening, the Demystifying PANS and PANDAS, and it's an excellent book. And they can, if they want kind of more of a deeper structured view, that's a great discussion. So I want to close by just hearing some of the things you're up to with your career and kind of what you're working on these days and how people can get involved with those aspects.
Yeah, thanks, Adam. The word doctor actually at its root means teacher. And that's the thing I like doing the most. So I have a mentoring program where a patient together with their practitioner or a practitioner alone can do a mentoring consult with me. And I will advise, give you my considerations, go over all the lab work for free, all of that. And then it's a 1-hour mentoring consult that either the patient or the practitioner can pay for. The other thing I have is a membership program. And that's an annual membership program. Gives you 6 lectures, over 40 videos and more coming. There are 5 dripped in every month, and they're 2 to 5 minute videos on nutraceuticals, herbals, the way I look at things, the way I assess a new patient, the way I do a physical exam, PANS, PANDAS, mold, mycoplasma, all of that, and monthly teachings where we take deeper dive into everything. And those monthly teachings are live, where I talk for about a half an hour, and then we do a half an hour of Q&A, and they're also recorded. So if you sign up now, you have all of them that we've been doing for the past year, plus the ones that are coming for the next year. So I think the membership program is my biggest passion, because I think it gives you so much information, and you get free 15-minute consults plus the Q&As. And you've got so much there, more than you get just in the one-on-one mentoring. But I have both of those. In the fall, I'm going to be taping my audiobook. Wow. So I'll be taping this book, but I'm adding 2 new chapters, one on Lyme, tick-borne disease, because I've even learned so much more since I wrote this book, and one on mold. Because through Jill and Neil, I've learned even more about that than I wrote in this book. So I want to update that in the audiobook. I'm not putting a new copy out of this book, though, so it'll be in the audiobook. And then I'm actually going to be doing a podcast too that it's different things. And one of my guests is going to be my son, because for the first time he said, "I want to talk about this, Mom." Wow. I always say in my lectures, one of the kids in the book is my son, but it's a different name, and every kid is a different name, but he doesn't want to be mentioned. And now he's ready. So those are my biggest passions. I do still see patients within my practice, but my waiting list is over a year long. And I'd much rather train other practitioners to do this, because that's the pyramid effect that gives so much more of us the ability to help these families that can be helped, but need us so much.
Very nice. Wow. That's so great. Well, this has been delightful. Is there anything else you'd like to leave us with? You're just so pleasant to speak with, and so clear in communication, and great listener. And it's just such a blessing to have this time with you. So if there's anything else you'd like to leave us with, that'd be great. And we thank you for being here.
No, I just want to say there is hope. Whatever the illness, search for a practitioner that will listen. And as a practitioner, be a listener. You're going to learn more from your patients than anybody else. And trust your gut, pun intended. You as a parent know your child. Don't let anybody tell you or push you down that you don't know and that they know better. But there is hope. This can get better. And I got lots of kids that help me to prove that every day.
Excellent. Well, thank you so much.
Thank you, Adam.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from that. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.